Brenda again today. You've all been getting to know Brenda over the last few weeks. We've been doing a lot of work in her mid-back area. She's been having troubles in the mid-back, kind of a sensation she can talk to you about. And today we're going to do something a little different. We're going to introduce Class 4 laser. So I'll talk to you a little bit about that. But Brenda, go ahead and just tell them kind of what we've been doing so far, kind of what you've been feeling, and how it's been responding so far.
Okay. Well, we've been doing graston for the last 3 weeks. I've been noticing a good change on the difference. It used to be like almost spiders under my skin, and now it's kind of turned into more of like a healing itch feeling.
Okay.
However, my husband saw the bruising from it.
Yes.
And said,
there we go.
Yeah.
Results.
Yeah.
He's like, what is that doctor doing to you? And I'm like, hey, people pay good money for that. I wear it proudly. So anyway, yeah, I just think we need to probably skip a week and get healing a little bit more, and then we'll go back to it.
You bet. Yeah. So graston is breaking up scar tissue. So think of it tearing down. And so you will get that petechiae, or that breakdown of scar tissue, which creates some of that bruising. And so we always tell patients ahead of time, if your spouse or loved one sees that, we're not beating you up. You know, it's all tough love.
Don't come a hunting.
Yeah, don't come a hunting, right?
Just warn them ahead of time.
Yeah, and a lot of times that actually indicates the need for it. So it shows that there's scar tissue in there that needs to be addressed. So today is kind of more in the rebuilding side of idea. And we're going to use Class 4 laser. If you want to come right over here. So this is through K-laser. There's different classes of laser. This is a Class 4 laser, which is the most powerful laser that's on the market today. It's a certified medical device. And there's settings in here for all sorts of different conditions that we deal with. And so just as an example, you can pick out a different area of the body. So in her case, we're going to be working through the thoracic spine. I'm going to come down to this additional treatments. And I'm going to be focusing on soft tissue injury. And we're going to go through this cycle. And then after that, we're going to go through an edema and congestion cycle. Okay? And so we just fire it up. And we wear protective glasses. Laser is very, very safe. There's really no negative effects to it, outside of the fact that if you did get it directly shined into the eye, it would burn the retina. It's a very powerful laser light. And so we just wear the protective eye gear for that reason. And so we're going to just be working through here.
I'll grab myself a pair too.
There we go. And this cycle is a total of 4 minutes. And so I'm going to just work through here. You can see the little red light. That kind of is a guiding light here. And I'm just going to be working through this area. Now generally what patients feel is they just feel like a soothing warmth. Everybody loves laser. We call it the pain eraser. And it's a soothing, warm feeling, kind of a deep penetrating, soothing sensation.
What does that feel like to you, Brenda?
Well, right now it's kind of cold because it hasn't been warmed up, but I've had it before, and it kind of reminds me of the heat from like a nice fireplace. It just kind of gives that warm, cozy feeling.
Yeah. So a Class 4 laser will penetrate about 6 to 8 centimeters into the tissue. Class 3 lasers will only penetrate about 4 to 8 millimeters into the tissue. So this will get real deep. And I'll just go through a little bit of kind of the science behind it. There's been over 500 studies, peer-reviewed medical studies that have been done on laser. If you Google Class 4 laser, you look it up. There's all sorts of medical studies that support the effectiveness of it. What it specifically is specific wavelengths of light. And just like light on a plant creates cellular reaction called photosynthesis, light in the tissues creates specific cellular reactions in the tissue. Now specifically what that is it increases fibroblast proliferation. So that's the cells that make collagen. Collagen is the nice spongy tissue that we want in the body. It's nice and elastic. Not like beef jerky, which is like scar tissue. It also increases macrophage proliferation, meaning those are the cells that clean up injured tissue. And we like macrophages to injured sites, damaged sites, because that helps to be kind of the garbage men that come in and clean up that area. In addition, it decreases inflammation and just promotes internal healing. It also stimulates the mitochondria that are in the cell nucleus to produce ATP, which is basically the fuel to the cell. So one of the challenges that we run into is connective tissue has very little blood supply to it at all. It's white tissue, very slow to heal, and just generally does not heal well once it's injured. So laser stimulates the cell bodies within that connective tissue, basically energizes the cells and allows them to produce that nice collagen and macrophages which clean up the injured site and basically promotes and accelerates healing. Phenomenal tool. So we use this all the time. And a matter of fact, if you come in here, as I do sometimes on a weekend, like I'll come in on a Saturday and see if anybody stole the laser, and it's always the joke around the office, almost every weekend one of the doctors has taken it home. And when I talk to the laser rep, one of the common things that they see is doctors often will end up getting turned on to laser for their own self. They'll have different injuries or nagging areas that have given them trouble, and they start using a laser and see the effectiveness on themselves, and they say, "Man, my goodness, if this is good for me, it's going to be great for my patients." And that's exactly what I did. I was running one night, and it was dark, and it was rainy, and I misjudged, and I came down hard on the curb. Boy, I really sprained my ankle. I mean, it popped, and I came down full weight, hit that curb with my ankle just completely popped, and I could barely walk home. And of course that night it was swollen up, couldn't walk the next day. And a chiropractor friend of mine said, "Why don't you try my laser?" And I had heard about it, and this was back like 2006, and I'd heard some research on it. And so I went over. Now I'm going to run through this edema and congestion setting. And so I'm going to just change up that setting now. And so this is all, again, this is all just really the doctor's discretion. And so we'll use these different settings based upon what we're dealing with patients. But it can be, headache, different types of headache, migraines, jaw pain, examples, of course, your spinal pain, like whether it's acute or chronic or spasm.
So acute or chronic, what's the difference between those?
Yep, acute or chronic. Acute is essentially new, recent in origin, and chronic is something that's been there for a while, so more of a chronic nagging or long-term type issue. But we do a lot of work with knees, feet, like plantar fasciitis, pain along the bottom of the feet. People will get a hip pointer pain, so pain right out here in what's called the TFL, right where the tendons come in and attach into the hip. That's a very common issue with a lot of postural disturbances. So we have those. Elbow, I personally use this a lot. I had a water skiing injury where I tore the tricep tendon, and I used the laser a lot to be able to help me and help that tendon to heal better. And I was able to avoid surgery along with some other type of treatment as a result. So it was really helpful. So we'll put these settings in, and let's see, we're going to do edema and congestion. This helps just with the flow through that area. And again, you'll see here it's about 4 minutes, 15 seconds. Okay? And it's running through this cycle. It's all been programmed in.
What other kind of conditions do you have you seen this work with? Maybe disc injuries?
Yep.
Help with the pain there?
Yeah, you bet. So in general, musculoskeletal pain, so pain in the joints, the tendons, the ligaments, the muscle is where laser really shines. So we use it a lot with patients that have acute disc issues. You hear about a slip disc or a herniated disc. We'll use it for that to help them kind of get over that pain cycle. Something that we commonly see is you'll get what's called an annular tear, so a tear on the outer wall of the disc. And that is what is a very serious inflammatory response, very, very painful. And laser is really helpful to be able to not only allow the disc to heal better, but also decrease the amount of pain. Am I getting right in the area?
Mm-hmm.
Good.
And viewers, if you have any questions, then feel free to type those out, put those in, and we'll make sure we answer those right now while we're live.
Yeah. So jaw pain, neck pain, whether it's acute or chronic, so new or older. Plantar fasciitis. I will tell you kind of what I found over the years is one segment of the population that just really has done the best with laser is the older population. If you're over the age of 65, you have chronic issues, arthritis type issues, I think personally that, you know, when we get older, or we don't have quite the circulation that we used to, there's just the cumulative damage of life, and we don't heal as quickly as we used to. And in the laser kind of just brings that kind of youthfulness back to the tissue and stimulates it to be able to heal like it once did. So we use this a lot in patients over the age of 65 with more chronic type conditions, and they get great results. I mean, that's an area.
How's that feeling, Brenda?
It feels good. It's warmed up in there. Just very relaxing.
Yeah, yeah. Another patient that does really well is people that have had old car accidents or older injuries. Maybe they tore their shoulder, 20 years ago playing sports, or they've had a nagging shoulder issue forever since then, or they injured their knee, from a fall years ago, and they've always had a nagging problem in their knee, or a chronic whiplash injury where they've had whiplash 20 years ago, and now their neck is just not the same, and it's always stiff, it's always sore, and you feel in there's all these kind of hardening and knots, kind of like beef jerky through there, and laser is really helpful to kind of regenerate those tissues. So I was just saying before, like with me, what got me into it is with my ankle, and so I went over and used his laser. Now when I popped my ankle, I expected to be probably 3 weeks on crutches, and I was back in the office in less than a week using laser. I mean, it was a dramatic difference. And I know my body, and I've had ankle sprains from playing soccer before, and I thought it's going to be a solid 3 weeks of me limping around. And I had a limp, but I was able to put weight on it and walk around without any assistance. Within a week, I was able to do everything in the office within the week, and so that sold me. That was a really big kind of personal impact that I felt and saw, and I know that it would have been a much different outcome. We've had some other interesting cases over the years. I had one patient, or a couple patients, that had what is that? Like with the toenail. You remember that?
Fungus?
Yeah, yeah. So we had chronic toenail fungus that would happen, and a lot of that is, again, the unhealthiness of the tissue in that area. It just becomes a breeding ground for bacteria, and we were able to get a program. I actually think I have it right here. So you can. One of the neat things with this has a USB port on it. And I can call the company. There's different researchers and scientists that are there, and so I can say, I got this patient that has toenail fungus, and he's basically has tissue in his toe that's not healing, and as a result of that, it's causing this constant festering. And so what they were able to do is they said, okay, let's program a sequence of laser that would be specific for that. He was able to download it to me. I'm able to upload it into this unit. And then we have the exact settings. And so I have it. So under my settings, and there it is right there, it's T for toe. And so we was able to program that in. And so sometimes I've been able to do that with just different questions that people have had on whether laser can help with peripheral neuropathy is a really common one. So numbness in their hands, numbness in their feet. There's specific settings we can use for peripheral neuropathy that's also been really helpful. And again, that's really common in the older population too. So,
how you feeling, Brenda?
Feel great.
Yeah. It feels great. I mean, it goes right hand in hand with graston. Breaking down the tissue, rebuilding, and having that tissue come back healthier. Yeah. So it's good.
So back to graston next week.
Yep, we'll continue the journey. Thanks to everybody for joining in. If you want to know more, feel free to pound that like and subscribe button, and that helps really get our information out to those who just don't know about the truth and quality of chiropractic care and everything involved. Again, this is Dr. Hansen, Brenda, and Dr. Glines behind the camera saying have a great day, stay healthy, and we'll see you soon.
You got it. Take